disbursement of leadership at your practice, what would you do? Well, let me tell you what we did, and some of my own personal stumbling. So I finished residency, and I was recruited to this practice, this team-based, patient-centered medical home back in 2010 that was launching at Brigham and Women's Hospital. And it makes total sense that I was recruited to be part of a team-based practice based upon all the training that I'd had in team-based care at Brigham and Women's Hospital. Actually, let me tell you, a little bit about it for a sec. Okay, let's move on. So, I get to this practice, and I'm on a team, and so on the team is Sonia the pharmacist, Sarah the social worker, Jennifer the nurse care coordinator, and Leslie the physician assistant. And so the basic concept was, and you guys know this, right? Interdependent model of care where interprofessional team is working at the top of their skill set, sharing the care, right? We've gotten rid of barriers, we're all in the bullpen together, twice daily huddles, right? On paper, interdependence, dispersed leadership, awesome. But that's not actually what was happening on the ground. And I was the big impediment. Because, I was trained to be a comprehensivist, right? I was trained to be able to handle everything, anything that was on my patient's plate. So when I arrived at this practice, I was taking care of all the acute things in their care. I was managing chronic disease and acute exacerbations. I was coordinating their care, handling their medication management, doing everything with a really sick patient panel. And you're probably saying, well, how the heck was that team-based care? Well, because we did handoffs. So Sonia would come in, the pharmacist, do medication reconciliation, then she'd pass the baton to me. I would do the visit, and then I'd pass the baton to Sarah, the social worker, who'd fill out some forms for the patient. And I got to tell you, that model of team-based care still made a profound difference. It made taking care of some of these folks go from totally impossible to just completely overwhelming. But it wasn't working. I was burning out. I was a new primary care doc, and yet I was burning out, and stuff was falling through the cracks. We had a eureka moment as a team in the care of this guy named Mark. I want to tell you about him. So, Mark is a 65-year-old limo driver that joined our practice pretty early on. And Mark's been spending his professional life driving people in parcels all over New England. He's got some amazing stories. He's got this thick white head of hair, rosy red cheeks, and his favorite movie is What About Bob, which is perfect because my favorite movie is What About Bob. Any other What About Bob fans? Yes, baby steps. Excellent. Now, Mark has a lot of medical problems. Severe diabetes that have left him with a neuropathy and a nephropathy, bad diastolic heart failure, bad spinal stenosis for which he's on chronic narcotics, depression, anxiety, and he's having these weird drop attacks, syncopal episodes we couldn't figure out. He'd get a heat sensation on his chest, and then he'd syncopize. This kept happening. He kept getting him into the hospital. He kept getting the huge, ridiculous workup, and his life was spiraling out of control. That's how he joined our practice. And managing his care, coordinating it, was just completely and totally overwhelming. So, one day, Leslie, the nurse care coordinator, is on the phone with him managing his symptoms, and he makes this offhand comment about alcohol. And Leslie says to herself, that's strange, Mark doesn't drink. We've checked that. We've checked that over and over. Mark doesn't drink. But that was the day he decided to tell the world he drank. A lot, for decades. So our team comes together, emergency meeting, all 5 of us, plus a medical student. And Sarah, the social worker, says, all right, guys, you know the plan. Got to get him detoxed. And she turns to me and she says, Aunt, you know how to do the outpatient detox, right? And I was like, oh, yeah, totally. But I didn't, right? I mean, I detoxed people dozens of times as a resident, but that was on the wards, right? That was with a computer. That was, right? Send someone to detox. Ding, go. And then detox happens. All right? I'd never done it. So she must have known this because she said, Andrew, you sure you don't want me to take that on? And I said, no, I've got it. I'm the doctor. And so team breaks up. We go our separate ways. I go and look up, outpatient detox question mark on the computer. Sarah comes into the room where I was, closes the door, and looks at me, and she says, Andrew, you sure you don't want me to take this on? I got so flushed and embarrassed. Started bumbling. I was trying to explain how busy I was and ask her to maybe take it. And she just interrupted me and she said, Andrew, I would love to take this on. I live for this stuff. And so she took point. She got Mark detoxed. She got him into AA. It was incredible. It worked because I let go a little. And so I let go a little bit more. And Sonia, the pharmacist, was no longer doing medication reconciliation. She was now managing his diabetes. And that enabled me and Jennifer, the physician assistant, to throw ourselves into figuring out his syncope, following up with all his specialists, checking everything. We soon discovered he was hypogonadal. He had low testosterone. We checked a testosterone patch on him. Those episodes went completely away. He got his life back. It was in the course of caring for Mark that we started baby stepping towards team-based care, towards real interdependency, towards real dispersion of leadership. And it worked, and it felt so good. I remember just becoming this zealot for team-based care. I'd travel around the country for primary care progress, but I was always telling people, team-based care, it's awesome. It's taking work off of our plate. And team-based care is great. It's getting us off the hamster wheel. And team-based care, it's literally salvaging our primary care careers. And then one day my spouse basically said, did it ever occur to you that team-based care isn't only just about you? And I remember being like, no. But it wasn't. I saw that one day, really starkly, at the end of the day, taking care of Mark. It was the last session. It was an evening session, so there was basically no one left at the practice. It was myself, Mark, and Sonia, the pharmacist. And I was finishing up with Mark. I was about to page Sonia to come over and finish up. And so I page her for the pass-off, and there's a knock at the door, and the door opens, and it's Sonia, and Mark goes, Sonia! And I'm sitting there, and I'm like, he never does that for me. So I'm finishing up, and the little voice in the back of my head is like, what goes on in this room when you're not here? And so, I sort of walk out, and they're like, ah! And I was just like, bye, I'm leaving. So I get to the door, and I basically was like, no, I need to know what goes on in this room. So I step out, look around, there's no one there, and so I snoop. I literally stand against the door, because there's a huge crack underneath the door, where if you're just standing there, you can hear everything. I'm sorry, what, HIPAA what? It was incredible. It was humbling. First, they start talking about his sugar control. She congratulates him on his dietary compliance. She runs his sugars, all of his sugars. A few of them were out of range, so she did this incredible differential, adjust his basal rate, and then I heard the distinct sound of them giving each other the high five. Then we go into blood pressure control. Blood pressure, great, run all the numbers, no change to his meds, but she's giving them this incredibly practical advice about when to take which med to avoid side effects. He squeals out, oh my God, this is so practical. And then they move on to iron, right? Mark was iron deficient. I started him on iron subs. He told me he was taking them. She said, are you taking them? He says, no. And I'm outside, I'm like, why aren't you taking them? Well, he has all these side effects, he says. They start talking about all the different side effects. She's identifying which formulations are better. She identifies which pharmacy has them. They come up with this great plan, and he squeals out, oh, you are such a gold mine, and they high-five again. So there I am, snooping on my colleague, 20-minute visit, right? 3 squeals of delight, 2 high-fives. They could have been giving each other the pound the entire time, and I wouldn't know. And I suddenly realized that Sonia wasn't taking work off my plate. That work was never on my plate. I was never providing that level of service. And those squeals of delight from Mark, they weren't about him liking her more than me, even though he probably did. They were about him communicating to her, you profoundly and consistently serve my needs. You talk to me in a way I can understand. You answer my questions. You don't rush out, and I appreciate it. I realized in that moment that team-based care wasn't just serving my needs, it was serving his needs. And I'm sitting there like, whoa. And then the door opens, and Sonia's standing right there, and she's like, Andrew? And I was like, quiet cards? Have you seen the quiet cards? She's like, what? I was like, nothing. So I walk down the hall, move into my room, and then I watch them. They both come out of the door. Mark is just so psyched. He's just like, yes. And Sonia is walking down the hall, and she's just got this bounce in her step and this fantastic smile. And I suddenly realized in that moment that team-based care was also working for her. Right? It was unleashing her as a provider. Right? It was harnessing all those things that brought her into healthcare in the first place. Why should I be the only one that gets fulfillment from this job? I drove home that night and really thought, are we sitting on this incredible reservoir of untapped healing capacity? I think we are. And I think it's really the providers, the clinicians, who have the obligation, the opportunity to unleash our colleagues. And it's not just the other members of the care team. It's the medical students in our midst. Get them off the sidelines. Get them engaged. They have just as much of an opportunity to help us transform, to help us lead. Foster was already talking about the stuff the residents are doing. There's so much untapped healing capacity amongst us. And you all know the numbers. We're not going to have enough primary care physicians anytime soon. The only way we're going to achieve primary care capacity is if we get other members of the care team to step up and step in. So how do we do that? Couple quick ideas, because there's been nothing studied on this. The first is you got to let go a little. You got to let go a little, especially for the physicians in the room, and that's not easy. Secondly, wait before you try and fix a problem. Right? Let someone else try and fix it. The vast majority of problems we face in healthcare, they don't require an MP or an MD to fix. Right? This is pretty straightforward stuff. Show people on their team that they can and need to fix some of these problems. Secondly, learn from your colleagues actively, especially the non-MDs. Show them that not only are they making a valuable contribution to patient care, but they're making a valuable contribution to your professional development. They're teaching you about your patients. They're teaching you about communities. They're teaching you about what happens when the rubber hits the road. And finally, share your failures publicly and regularly. But not from a place to shame, right? Not from a place to shame. Get rid of shame. This is about group learning, right? Primary care transformation has nothing to do with technical knowledge.